myocarditis. So myocarditis is the acute inflammation of the myocardium. So myocarditis can be divided into acute myocarditis and chronic myocarditis. So causes for myocarditis. Causes of myocarditis can be idiopathic causes, infective causes, and toxic causes, autoimmune causes. Alcohol, hydrocarbons are the main causes for myocarditis. So under infective causes, we can talk about the Coxsackie virus. Under infective causes, we can talk about the viral causes, bacterial causes, spirochetal causes, parasitic causes, and fungal and rickettsial causes. So under viral causes, we can talk about the viruses such as Coxsackie virus, adenovirus, and poliovirus, hepatitis virus, influenza virus, and myocarditis associated with the HIV virus can be seen in up to 20% in postmortem and less than 10% in clinically. So if we talk about the parasitic causes, Toxoplasma gondii and Trypanosoma cruzi. The Trypanosoma cruzi can cause disease known as Chagas disease. So this Chagas disease can lead to the myocarditis, and Toxoplasma gondii is the myocarditis with the heart blocks. So other causes is the bacterial causes. So under bacterial causes, the most common bacteria which can cause myocarditis is the Streptococcus, and diphtheria also can cause myocarditis. In diphtheric myocarditis, there is heart blocks are there. So those heart blocks known as toxin-mediated heart blocks. And spirochetal causes. Under spirochetal causes, there is a Lyme disease, leptospirosis, we can tell, and the other causes such as fungal causes and rickettsial causes also there. So if you talk about the toxic causes can be classified into the drugs and radiation. So drugs drugs are the causes for the hypersensitive reactions. So the drugs known as methyl-dopa, penicillin, and sulfonamides, antituberculous drugs, those are the drugs which can cause myocarditis. And radiation also can cause myocarditis. Usually radiation is causing pericarditis, but myocarditis also can cause. So other causes is the autoimmune cause, and hydrocarbons and alcohol are the causes for the myocarditis. So myocarditis can be classified into the acute and chronic phase. So if you talk about those are the classification of myocarditis. That's the classification of myocarditis. If you talk about the causes, viral causes such as Coxsackie virus, these two are the most common viral causes which can lead to myocarditis. Also there is a polio, hepatitis, HIV, and those influenza. Those are the viral causes. If you look at the bacterial causes, those are the, if you look at the bacterial causes, Streptococcus, diphtheria. Here in diphtheria there's a toxin-mediated heart blocks are there. Streptococcus is the most common bacterial cause for the myocarditis. Here these two is the most common causes for under the viral causes, and other causes are the parasitic causes. So under parasitic causes, you can see Toxoplasma gondii, Trypanosoma cruzi. So Trypanosoma cruzi is the parasite which can cause Chagas disease that can lead to myocarditis. Toxoplasma gondii is the cause for the myocarditis in newborns and immunocompromised patient. So other causes such as spirochetal Respiratory causes such as the Lyme disease and leptospirosis. So other causes also there: fungal, rickettsial causes. So viral causes, bacterial causes, parasitic causes, spirochetal causes, fungal causes, and rickettsial causes. Those are the causes for infective causes. These are the infective causes. So we can infective causes. These are the infective causes for the myocarditis. So other causes. So if you talk about toxic causes, we can drugs and radiation. Drugs such as penicillin, methyldopa, sulfonamides, and antituberculosis drugs. So those are the drugs. Radiation usually causes pericarditis, but also can cause myocarditis as well. So other causes are the autoimmune causes. As an example, you can see giant cell myocarditis. So other causes are the alcohol, hydrocarbons. So that's all about the causes for the myocarditis. So let's move on to the pathological part of the myocarditis. So if you talk about the pathology, so before going to the pathology, myocarditis can be classified into the acute phase and chronic phase. So in acute phase is characterized by the flabby with focal hemorrhages. So in chronic phase is characterized by the enlargement and hypertrophy of the myocardium. So in histology, if you move to the histology there is a acute infiltrate present. So in case of viral etiology, there is a predominant cells are the lymphocytes. In case of bacterial etiology, predominant cells are the polymononuclear cells. Eosinophilic cells are the cells which can be there in allergic and hypersensitivity causes. So pathological aspect is the acute phase. Acute phase is characterized by the flabby with focal hemorrhages. Chronic phase is characterized by the enlargement and hypertrophy of the myocardium. So that's about the pathology. If we come to the histology, always there is a inflammatory infiltrate is present. So that's in histology. So lymphocytes are predominant in the viral causes. Polymononuclear cells are predominant in bacterial causes. Eosinophilic cells predominant in allergic and hypersensitivity causes. So that's all about the pathology and histology. So let's move on to the clinical features. So clinical features in myocarditis, there's a range. So the clinical features can be ranged from asymptomatic state, which is associated with the limited and focal inflammation, to the fatigue, shortness of breath, also known as dyspnea, palpitation, chest pain, and uh, congestive heart failure, fulminant congestive heart failure. Fulminant congestive heart failure is due to the diffuse involvement of the myocardium. Fulminant very severe congestive heart failure mean the left heart failure is secondary to right heart failure. So those are the clinical features. Clinical features. Asymptomatic state is the first one. Asymptomatic state. Other one is the shortness of breath. This is also known as dyspnea, shortness of breath, palpitation, fatigue, chest pain, fulminant congestive heart failure. This is due to the diffuse myocardial involvement. So these are the clinical features: asymptomatic state and shortness of breath, palpitation, fatigue, chest pain, fulminant congestive heart failure. So if you look at the physical examination, there is a soft heart sounds, third heart sound is present, and often tachycardia is followed, and pericardial friction rub may be heard. So those are the physical examination. Pericardial friction rub. So that's about the physical examinations. So if you talk about the investigations, so there are a lot of investigation. First, we can do chest X-ray to whether cardiac enlargement is there or not. So second one is the ECG. In ECG, you can see ST wave abnormalities and arrhythmias and heart blocks in case of diphtheric and Lyme diseases cases. So other one is the increased cardiac enzyme levels such as troponin, creatine phosphokinase, and myoglobin, and those are the cardiac biomarkers. So those enzyme levels can be increased. So viral antibody titers can be elevated, and endomyocardial biopsy can see endomyocardial biopsies we can use for the check to the acute inflammatory infiltrate. So other one is the viral DNA can check via the PCR. So those are the investigations. Chest X-ray, ECG. These cardiac biomarkers are elevated when there is a damage to the heart muscles. So this viral antibody titers. So that's all about the investigation. First, you can check the chest. You can see the chest X-ray to whether there is a cardiac enlargement or not. ECG, by ECG you can see ST wave abnormalities and arrhythmias and heart blocks. So cardiac biomarkers can be there. Cardiac biomarkers such as troponin, creatine phosphokinase, myoglobin. So viral antibody titers and endomyocardial biopsy to see their inflammatory infiltrate transitones, viral DNA via the PCR. So that's about the investigation. So if we come to the treatment, first we have to find the underlying cause for the myocarditis, and we have to treat it and we have to eliminate it. Then we can advise for the bed rest for the acute myocarditis, and athletic activity should be avoided for 6 months. And other one is if there's a heart failure, you have to manage the heart failure with diuretics and angiotensin converting enzyme inhibitors, also we can known as ACE inhibitors, and angiotensin 2 receptor blockers, and beta blockers, spironolactone with or without digoxin. So we have to manage the heart failure if there's a heart failure. So other one is the antibiotics are administered when appropriate, and uh, non-steroidal anti-inflammatory drugs are contraindicated in acute phase. And the we can use the there's other one is called IV immunoglobulin. IV immunoglobulin is you have beneficial effect for the left ventricular dysfunction, and the other if there is this myocarditis due to the virus, so we can use antiviral drugs, immunocompressive drugs such as interferon gamma, and immunomodulators we can use such as interleukin 10. So those drugs are for the antiviral causes. So that's about the treatment. Underlying cause we have to manage first. Second one is the bed rest for acute phase. Third one is for the athletic activity should be avoided. The management of heart failure via the diuretics, ACE inhibitors, angiotensin 2 receptor blockers, beta blockers. So that's about the management of heart failure. Then steroidal anti-inflammatory drugs are the contraindicated in acute phase. The other one is the IV immunoglobulin, immunocompromise. myocarditis. So that's all about myocarditis. So thank you guys.